My name is Jason Vanson. I guess we'll start there. I'm the research scientist for the Stewardship and Clinical Appropriateness Program here in Regina. So I work a lot, obviously, with the Antimicrobial Stewardship Program. And so what I wanted to present today is just to talk about the Antibiotics Wisely Toolkit. So I can't take a ton of credit. These are slides, for the most part, that people from Choosing Wisely have put together, and they sent out, distributed across their national network to have people be able to go and spread the word about the availability of this toolkit amongst each of the provinces and territories throughout Canada, so that they can spread the word that this thing is available. So that's kind of what we're going to talk about today. I know what we're getting to the end, towards the end of sort of cold and flu season, but this is not a toolkit that's going away, so these types of resources will be available in coming years through their website. And of course, as you have patients with various upper respiratory tract infections throughout the spring and summer, these will still be available for use. So we're going to talk about the Antibiotics Wisely Toolkit. As I said, this is a Choosing Wisely Canada initiative, so let's just start there. Choosing Wisely Canada. So if you haven't heard of it, they are essentially the national voice for reducing unnecessary tests and treatments in healthcare. So obviously they cover more than just antimicrobial use. Any kind of test, any kind of therapy that's given, they want to ensure that things are being used appropriately. So that's kind of their mandate. A little bit of history for Choosing Wisely. So they started in 2012 in the U.S. It was made up of about 80 medical societies, and they had about 500 or more than 500 recommendations at that time. In 2014, Choosing Wisely Canada came on board, so we had about 70 societies that were involved. These are different professional societies and medical societies, things like that, that put out the recommendations. And again, in Canada, there was more than 300 of those. And so at this point in 2019, there are Choosing Wisely organizations in over 25 countries. And the cool thing about Choosing Wisely is that it's got a bit of a different approach. So it's a clinician-led approach. So recommendations are put forward by physicians, by pharmacists, by nurse practitioners, so that it's the ideas and the evidence coming from the people who are sort of on the front lines, so to speak, and that is given it a little bit different. So it's this bottom-up approach, right? So rather than maybe Health Canada or someone mandating certain things, this is one of those things that's really led by the people who are on the front lines, seeing patients, interacting with people, and putting forth these recommendations about appropriate care. As I mentioned, everything is evidence-based, so they really try to vet the information through the various societies, depending on what the recommendation is for. And then all of the information that's on, for example, their website or their pamphlets and things like that, will have references, and we'll speak a little bit about the evidence behind that, so that people have a good way of learning more about what it is they're talking about. And it's simple. They try to make everything simple. All the messaging is simple. Do not do this instead, those kinds of things. And it's not only a guide and recommendations for clinicians, but also for patients. So the idea here is that patients can look through Choosing Wisely recommendations and understand more about the questions they could ask of their doctor, for example. Do I need this test? Is this antibiotic necessary? Those types of things. So that's kind of the four key pieces that make Choosing Wisely somewhat unique. So as I mentioned, this is something that they want patients and the public to know about as well. And so they have these types of things. 4 questions that you can ask your doctor. So in general, do I really need this test or this treatment or this procedure? What are the downsides to having this? What are the potential bad things that could happen? And are there simpler, safer options for me? And what happens if I do nothing? So, when we talk about this in the context of, say, antimicrobials, if you've got a patient who's coming in with an upper respiratory tract infection, there's, more than 90% chance that it's viral in origin. The doctor is talking about maybe prescribing an antibiotic. We want patients to feel comfortable asking these questions. Do I need an antibiotic? What are the downsides to taking an antibiotic? Is there something else I could do instead? And what if I don't do anything? What could happen? So important for patients to be able to feel comfortable asking those questions. And we're going to talk about this a little bit later, but there's often this misconception amongst prescribers that every patient is coming in wanting an antibiotic for their cold or for their flu. And so we want patients to feel comfortable asking those questions, and then it can help to, I guess in some cases, ease the mind of the prescribers so that they know that it just helps to reinforce that the patient's not there necessarily shopping around for antibiotics. And they'll be happy with other forms of care and treatment plans. And so they have these really neat posters and stuff like this. And I really like these, and you might see them around in various offices and things like that. But this whole idea that more is not always better. And I think people get caught up in, when you have what is essentially free health care, give me all the tests. I paid for it anyways in my taxes, so give me all the tests. And I think it's everywhere in our life. You go to a buffet, you've already paid for the buffet, so I'm going to take all the orange chicken and all the, ginger beef, even though I don't really like ginger beef, but I paid for it, so I'm going to take it anyways. So getting the idea through to people that just because a test is available or a therapy is available doesn't mean you need it. It doesn't mean it's going to be beneficial to your care. It may not provide any extra information. So just this is their front public-facing campaign, and I think it's really neat, and it's got some good visuals that they have. So. Okay, so that's sort of choosing wisely broadly in a nutshell. So now I want to talk specifically about their Using Antibiotics Wisely campaign. Now, of course, this is a national campaign, so you can get it in English and in French on their website. Everything you can flip to the French side. And they have some really great visuals for in physicians' offices and pamphlets and handouts and just information for clinicians as well. So we'll talk a little bit about what all of the different things that make up the toolkit here. So this campaign launched in the beginning of November, I believe, in 2018, so kind of right in line with flu season. So really just trying to make clinicians aware that when we're talking about antibiotics, we want to ensure that we're using them only when necessary. And so we're not prescribing for viral illnesses and things like that. And then what are some of the tools that clinicians can have to be able to sort of have those conversations with patients, bridge any knowledge gaps that might exist so that patients are aware of when antibiotics are necessary and not. And so that's what a lot of the tools are in here. So when you look at, if you go on Choosing Wisely Canada's webpage, and if you just Google Choosing Wisely Canada, you'll get you right there with the first link. And you can look at different specialties. So if you're a family medicine physician working out in the community, let's say, you can click the family medicine specialty, and it will come up with the list of various recommendations that they have. So I think there's 13 for family medicine, so this is the first 6. And it will just give you things. So there's don't do imaging for lower back pain unless red flags are present, and so on and so forth. Of course, antibiotics, I think antibiotics show up on many of the different specialties, depending on where they're being used. So here's an example right here. So if you click this thing in the web page, you can see don't use antibiotics for upper respiratory tract infections that are likely viral in origin, like influenza-like illnesses, or those that are self-limiting, like sinus infections that have been going on for less than 7 days. So it gives you sort of that blanket statement of here's what you don't need to use antibiotics for, and then there's a little bit more information you can see in the paragraph below there, and then usually when you open them up, they'll also have links to whatever references and stuff like that are included in that statement. So very useful tools for just getting some big information on. Again, useful for clinicians to remind themselves of things, and useful for patients to be able to get some information about the types of questions they may want to ask their providers. So that was for family doctors. Nurse practitioners have lists as well. And again, like I said, there's all kinds of different specialties on there. So again, here when we're talking about don't prescribe prophylactic antibiotics to prevent traveler's diarrhea, you could actually be doing something worse for that person by clearing out their, gut microbes before they go to places which may have something like, they're talking here about extended spectrum beta-lactamase producing bacteria. So you clear out their gut bacteria before they go. They come into contact with these things when they're there. They don't have their normal gut flora to sort of keep the bad ones at bay. And so they can come back with these drug-resistant bacteria colonized inside of them. So anyways, just more great sort of topics there that you can look through. One of the things that's important to talk about, and that Choosing Wisely makes note of, is trying to break down those barriers to not prescribing antibiotics for viral illnesses. So we know, and I would say that probably every clinician knows, every prescriber knows, that antibiotics don't work for against viruses. And yet we still see many prescriptions of antibiotics for viral illnesses. And so, the big questions are, well, why is that happening? What is preventing people from not prescribing these things? And so, when you look into the literature or when you speak with family physicians, there are some themes that sort of will come up. And I don't mean to be picking on family physicians. They're just a key group that we work with in the community, and that's where a lot of prescriptions happen. So, so one of the things that comes up is the patients want it, and that's what I mentioned already. So there's usually this idea that patients, when they come to me and they've got a cold, they just want me to give them their antibiotic. And if I don't give it to them, they're going to go to the walk-in or the ER or something, and they'll get their antibiotics somewhere. So that's one common theme that comes up. Sometimes with antibiotics, certainly with other tests, when you're stumped, I don't know, that could be viral, could be bacterial. Better to do something than nothing. So let's give them the antibiotic, even if it's probably viral. Let's give them the antibiotic just in case, that kind of thing. Time constraints is a big one. It's much easier to take the 30 seconds to write a prescription and give it to the patient and send them on their way than to explain to them why they don't need an antibiotic, what the potential harms are for antibiotics, things like that. I don't want to get sued. If I don't give this person an antibiotic and they end up developing a pneumonia and getting really sick and go to the hospital, I don't want to get sued. I don't want to be the one who didn't do something that I should have. And then, of course, there's sort of habit. I've always done this. For 30 years, I've been practicing, and every patient who comes in with a cough, they get their, course of antibiotics, and everyone's happy and sort of, no harm done, which is not true, but that's, one of the things that comes up. So these fall into, several categories. It's knowledge barriers. I don't think that's a big one. I think, most clinicians, most prescribers recognize that antibiotics will not work against viral illness, but there might be other knowledge pieces there, like how do I decide if it's viral or bacterial? What kind of tools can I use to help me in my clinical decision making? Skills, so, how often you've prescribed medications, how many times you've come up against these symptoms, how familiar you are with using the tools and things like that. Beliefs, so often this is one of the things that comes down to things like, does every patient actually want an antibiotic when they show up in your office with a cold or flu? That inertia, so we talked about that behavior change. Behavior change is hard, we all know that. So changing your practice is difficult. If you're used to just prescribing an antibiotic, it might be one of those things where you have to make a conscious effort to change that. Social influence. So yeah, everyone in this practice, we just prescribe the antibiotics and send the people on their way. And then that can work the other way too. If you've got a practice where people change that behavior and are more conscious about their antimicrobial prescribing, that can influence other clinicians in the same office. And then time. So yes, everyone's busy. Clinicians are busy. You're doing a walk-in clinic. You got 30 patients waiting. It's already 3 o'clock, and you realize you're not going to get home by the end of the day if you're not getting people through the door quickly. So, but we do have to balance that with the potential harms of providing unnecessary antibiotics to people. So, common myths. So, one of the, and there's some papers listed at the bottom here, some references listed there, but one of the big myths, and I've mentioned this a couple times already, all patients coming to the clinic with an upper respiratory tract infection want antibiotics. Based on the literature, that does not seem to be the case. There have been several studies that have looked at this and have done interviews and surveys and things like that, talking to patients. Often what it is patients want a diagnosis and a way to relieve their symptoms. So when a patient comes in and they're told, you have a viral illness, go home, you'll feel better, that's not necessarily the best way to handle that. If it's they come in and it's like, you know what, you are sick. I recognize that, and they feel that sympathy or that empathy from their provider. I recognize that you're sick, you've got the flu, that sucks. You're going to feel crappy for a number of days, depending on when they're there. Here's how you can help with symptom relief, and that's a big piece. Is people just want to know, how can I feel better? If an antibiotic isn't going to work for me, okay, fine, but I feel crummy. How do I get rid of this headache? How do I, all those kinds of things. So it's really about switching from what you're doing. We're not going to provide an antibiotic, but here's what you can do to feel better instead. And then one of the things we'll talk about is delayed prescriptions, where maybe you're not sure if it's viral or could be bacterial, but you can wait a couple days and see if symptoms get worse. So you can write a delayed prescription. I'll give you this prescription. You can't fill it until whatever, 3 days from now. But if you're not feeling any better by then, you can go ahead and fill it and that kind of thing. And so often prescribers will say, well, yeah, if I give them a delayed prescription, they're just going to wait the 3 days and go fill it no matter what. And again, when you look at the evidence, actually only happens about 30% of the time. So, which could be considered a high number, but if you consider that if 50% of our prescriptions are inappropriate, and if you could give every single one of those a delayed prescription, that only 30% of that group would still get that prescription, we're still cutting a huge number of unnecessary prescriptions down. How can the tools that are in the toolkit support your practice? So, number one, making patients aware of the problem of too much antibiotic use. So this is, as much as we want to ensure that clinicians are using this resource properly, it really is a public awareness campaign on the other side of the coin. We need the public to be aware that antibiotics are not an unlimited resource. The more we use them, the more resistance we see, and we need to stop using them inappropriately, and that they do have side effects. There are, bad things that can come from using an antibiotic, particularly if it's not necessary. Addressing the patient's concerns at the moment of the encounter. So again, when you're sitting there with the patient, it's a way to talk about their concerns and provide that information and that education and ease their anxieties about the illness. Convincing your colleagues. So, if you work in a clinic where there's a lot of collegial back and forth about, various tests and things like that, having these tools and having the evidence to back you up, it's a great way to help convince others that, maybe every case of acute otitis media, we don't need to give them an antibiotic because here's some evidence that shows that it's, not always necessary. To ease your own practice change. So again, we talked about that. Behavior change is hard. So using these tools, things like viral prescription pad and delayed prescriptions can help you to feel like you're still doing something for that patient while not providing an unnecessary antibiotic. And of course, to save time. So again, time management. If there's a way that I can ease that conversation with the patient so it goes a little quicker, I can give them some of the high points and then they can read through more of the details in the pamphlets and things like that. It's a great way to help those conversations go quicker so you don't have to take, if you feel like it's going to take you 10 minutes to explain to the patient. And again, I think Casey had presented some research a little while ago that it often isn't actually that long. So it adds maybe 30, 40 seconds onto the consults for some of these cases. So some of the big messaging is around upper respiratory tract infections, right? So don't routinely prescribe antibiotics for acute respiratory infections in primary care settings. So when we talk about otitis media, any patients that are older than 6 months that are vaccinated, it's very likely to be a self-resolving or a viral origin type thing, so you don't need to prescribe antibiotics for that. For pharyngitis, so when you've got a patient with that wicked sore throat, you can use a modified Centaur score, which is a way of sort of scoring their symptoms, and depending on what number you get, will help you determine whether or not this is something that might require an antibiotic. Could be strep throat, for example. Sinusitis, so these POD symptoms, I'm not familiar, I don't recall what the acronym is, but there are these symptoms that you can use to, again, score people for sinusitis. Pneumonia, having that objective evidence. So, I mean, I have friends that are, I have pneumonia, I got, they got a cold, oh, I got pneumonia, I got to go get my antibiotic. And it's like, did you get an x-ray? Did you actually see the stuff in your lungs? So having that objective evidence to make those decisions. Acute exacerbations of COPD, so having inhalers for that, not necessarily requiring antibiotics for every flare-up. Bronchitis and asthma, again, inhalers, and then other upper respiratory tract infections like your common cold, influenza-like illnesses. They're viral, period. Full stop, no need for antibiotics. They will not help. So just a couple of examples then of some specific tools that you can use that are in this toolkit, and I'm just going to sort of go over them quickly. There are things that, like I said, you can go on the website and you can find all of these things and see how you can work them into your practice or into your clinic. So if we're talking about a patient that has pharyngitis, and they had some actually really good like case studies. I'm not a clinician, so I took them all out because I would look like an idiot talking about them. So, but you can, if you want that kind of information to go through, if you want to do one of these presentations within your clinic, I'd be happy to share the case studies that Choosing Wisely Canada put in for here. But let's talk about pharyngitis. You have a patient with pharyngitis. What kind of things can you do for them? So again, it's most likely to be viral. If you're going to do that swab test to look for a strep and it comes back negative, then you know you're dealing with a viral infection. So you can have that viral prescription pad. So this is something that our antimicrobial stewardship program here in Regina has touted a lot. It was something that we developed a couple summers ago at this point, and started sharing with our community prescribing partners. And that's really what it's designed for, is here's a tool when you have a patient who comes in with a viral illness. What can you give that person so they can walk out of that appointment? If they don't need their antibiotics, so what can you give them so they can walk out with something in their hands so they feel like they got something for their appointment? And so we kind of came up with this thing. And this particular version was sort of co-opted by RX Files. They made it look really nice and pretty. They've modified a few things on it, and then they also translated this into like 13 different languages. So the links are all on the website there. You can, if you have patients whose first language is not English, you can grab it in multiple different languages, and it's just a great way to give them that information, and they might be more comfortable reading it in their mother tongue. So there, you got your patient name, the date. You can check off whatever they've shown up with. Maybe they've got the flu. It's going to last about 7 to 14 days. It's a really cool piece that gives the patient an idea that, you know what, if this is day 4, you might be feeling this for another 10 days still. You know, it might last that long. The little black box there talks about, why you haven't been given an antibiotic, that they can have side effects, what you can do to feel better. So this is kind of that key piece. Get some rest, drink plenty of fluids, wash your hands frequently to prevent spreading it to other people. Over-the-counter medication for that symptom management. So you've got a fever and aches, you've got multiple different options there, Aleve and Advil and Tylenol. Not to promote any one of those in particular, but they were just things that people would recognize, and then the sort of generic names there with them. Sore throats, you can take your cough candy, your lozenges. Nasal congestion, you can use the nasal rinses. And then others, so we always leave that little piece there. So if the prescriber wants to, give something else specific, other recommendations, it's there. And then, of course, returning to your provider if your symptoms don't improve, you develop a persistent fever above 38 degrees or whatever the care provider would consider an appropriate temperature to return to care. And then again, other. And then you've got your prescriber down here. So a great tool to use. We've gotten great reception both from healthcare workers and from just the general public. Oh, I saw these in my doctor's office. It was really nice to have that, to have something to go home with. I could put it on the fridge and it would remind me to take my Tylenol every 4 hours or whatever the case would be. So that's one option. Again, great posters and visuals. So these will actually come from Public Health Ontario, but they're great things to either have as a small version in your exam room to hand to the patients, or a bigger version sitting in the waiting room or something like that. It's a really great way of priming patients for that conversation. So if they're sitting in the waiting room, and they've come in because they got a sore throat, and they see this sitting up there, oh, hey, I've got a sore throat, and they can look, and it's a great little infographic, tells you about how many people actually require antibiotics for a sore throat, how many don't, other things you can do, you know, you got ice cubes and washing your hands and all that kind of stuff there. I love the little, you know, the little puking people and the headache and the guy in the toilet for all the side effects of antibiotics that can happen. 3 out of 10 people can experience this. So just giving that the patient an idea about this. So maybe when they come in, and again, this is something we've heard from some of our community providers is, yeah, you know what, the patient came in and I started talking about they don't need an antibiotic, and they'll say, oh yeah, I read the poster in the waiting room. So these are great tools to help prime patients and start giving them that information while they're sitting in the waiting room anyways. So these help to address expectations. So your viral prescription pad, the patient gets to leave with a plan, not necessarily a pill, but they'll get that plan of how to make them help themselves feel better. Again, myth busting here. Not every patient who walks in is expecting an antibiotic. They just want to know, what can I do to feel better? And oh, that's that right there. They want a diagnosis, a plan to control their symptoms, and reassurance. You're sick, you will get better, you know, and antibiotics aren't going to help that. So sinusitis, again, viral prescription pads there. This is their delayed prescription example. Posters that you can have in your waiting room, or handouts that you can give to patients. They also note here that you can integrate the viral and the delayed prescriptions into your existing medical record. So they have e-forms and instructions available. So whether you're using TELUS Health, Oscar, Accuro, you can actually build these things into your electronic health record, so you can access them very easily while you're in the patient chart. Otitis media, so again, viral prescriptions, you've got the delayed prescription, you've got posters. An important piece here is ensuring the right dosage of pain medication, particularly for kids. And they've got just some other really neat things. So obviously you're not going to have a moving poster, but they've got these images. If your clinic is into social media and stuff like that, these are great posts to make so that any of the patients that follow your clinic can see these things, recognize that the clinicians in that clinic are stewards of antimicrobials, and so they are going to prescribe appropriately for you. The static poster, too, is a really neat poster just to have up in the clinic. It's just a nice, simple message. Some of these posters here, like this one that comes from Public Health Agency, really gives people the vocabulary to decide what is a cold and what is a flu. That is something that is very often misconstrued amongst the public. Everyone who gets a cold has the flu, and everyone who has a cold or everyone who has a cold says they have a flu, and everyone who has a flu just says they have a really bad cold, and they're two very different viruses, and they have very different things. So it's a great way, again, to give people that information. And this is just repeating, you don't need antibiotics unless there is a superimposed bacterial otitis, sinusitis, or pneumonia for these various syndromes here, common colds, influenza, bronchitis, bronchiolitis, and asthma exacerbations. So this is just like a very big, broad overview. There is lots of cool information and resources on the website, so I'd encourage you to check it out, choosingwiselycanada.org there. You can follow them on social media. They do all kinds of cool posts and stuff like that you can share and make available to patients. And they've got posters, pamphlets, the calculators for those various scores, like the Centaur score and things like that. The delayed prescriptions, the viral prescriptions are there, and the various conversation tools, and from all the different groups that those are connected to. Physicians you can do various courses that they've got, and you can get your continuing education credits and stuff like that. So you can check out the links there if you're interested. And I think that's it.